Hi guys, my name is Valerie. This is Emma,
Hey guys.
and we're talking about acai berries. Okay, so what is it? It's a dark purple fruit that grows on palm trees in the Brazilian rainforest. Many Brazilian natives have been using acai berries for thousands of years due to its healing powers. It's a great source of many vitamins and minerals, including B1, B2, B3, iron, potassium, phosphorus, calcium, and a phytonutrient called anthocyanins. This is only found in plants, and it's also high in antioxidants, neutralizing the effects of free radicals in the body. Those antioxidants include vitamin C and E. And it's also full of omega 6 and omega 9 oils, which help protect cardio health.
So who would use acai berries? These are going to match up a lot with the effects of acai berries coming up, but here's a quick overview. So acai berries can be used for people who are at risk for type 2 diabetes, people who have a risk for cardio or coronary artery disease, and people who want to lower their LDL cholesterol levels.
Good. Some of the effects of acai are it helps inhibit the activity of COX-1 and COX-2 enzymes, which produce prostaglandins. So, if they are inhibited, then they will help reduce inflammation. It also can help reduce total cholesterol levels, LDL cholesterol, as well as the ratio of total cholesterol to high cholesterol ratios. It's also got an immune stimulating effect. It helps assist in wound healing with those extra vitamins and minerals and anti-inflammatory properties we talked about, and also reducing the fasting glucose levels by 5% compared to baseline levels. And we'll go into a study about that in a minute.
So some side effects or adverse reactions that you want to be careful about. It can cause what is called Chagas disease, which is a foodborne illness that's really present in Brazil. And then if you have any known allergies to acai berry family of plants, you also want to be careful with that. Again, because of all of its abilities to help us and help our bodies, we want to avoid using it with other lipid-lowering agents or other blood glucose-lowering agents because you can have a higher risk of going into hypoglycemia or having too low of lipid levels. Again, use caution with autoimmune disorders and immunosuppressants if you're pregnant or breastfeeding, and then kidney diseases that may increase your potassium levels.
Okay, some of the effects that you'll find when you take acai as well as others, these are similar to the effects when you would take statins for cholesterol, anti-inflammatories, insulin as well, same effects. And then you can also get the antioxidants from other berries, including blueberries, cranberries, blackberries, goji berries, kidney beans have them, pecans, dark chocolate, very high in antioxidants. So one of the studies that we reviewed was a pilot study. They found that it was a bunch of, it was 10 overweight adults. So one of the limitations of the study was there only was 10, and 9 out of those 10s were Hispanic ethnicity. But they found that if they consumed 200 grams per day of acai powder in a smoothie for 1 month, that they were able to reduce their fasting glucose levels, their insulin reduced, and their total cholesterol compared to baselines was greatly reduced. If you look at this graph here, you can see that representation. And the study found that it mostly reduced the LDLs, which are the lousy cholesterol.
The study that I found, again, was a pilot study, so one of the limitations was it only had 7 subjects, but these subjects were off-season junior hurdlers at a training camp. The research found that in 6 weeks of consumption of acai berries had no effect on their sprinting performance, but it increased the total antioxidant capacity of plasma, attenuation of exercise-induced muscle damage, and in the improvement of serum lipid profile. So it didn't necessarily help the athletes perform better, but these characteristics helped maintain their body in a better condition. So our recommendations. It is a good option for like a pre-diabetic person or a person who has high cholesterol. If you are already on insulin for diabetes or taking cholesterol medications, it is probably not recommended because you can have side effects due to too low of insulin or too low of cholesterol, as we mentioned before. It's important to know that it's not a substitute for modern medicine or healthy diet and exercise. So it is still important to take your medications prescribed by your doctors and eat a good healthy diet and exercise on a regular basis. However, it may be a good source as a substitute for unhealthy food choices. Val and I really recommend to talk to your physician if you're going to take these drugs, because there are possible adverse drug interactions as mentioned before. But overall, if somebody would want to take them, they're not necessarily going to do harm if you don't have any of the conditions that we've talked about previously. And then here is our 2 references for the sources that we used.
Thanks, guys.